to today's session on shoulder health. Just like to thank everyone, also to note that it is an important session and we did receive a lot of RSVPs. This is an indication of how important people think their shoulders are. Either that or people have had issues in the past and would like to get some advice. So before I introduce our two guest speakers, I would like to begin by acknowledging the traditional custodians of the land in which we meet across the various parts of the state, and also to pay our respect to elders past and present and extend the respect to all Aboriginal and Torres Strait Islander cultures. So thank you everyone for joining. First of all, I'd like to introduce Janet McCarthy, who's a senior physiotherapist at the Austin, and also Kate Gamble, who's also a physiotherapist from Steps Neurological Therapy Services. Thank you both so much for joining us today. So both Janet and Kate have elected to present, sharing their screens for a power presentation, one after each other, and also if you have any questions that they happen at the end of their presentation. And thank you. So if we could start with Kate, if you'd like to share your screen.
Okay, great. Righty, so hello everybody, my name's Kate, as Georgina mentioned. Great. So just a quick overview of what we'll be speaking about today. We're going to start off introducing why we are choosing to talk about shoulder health today. I'm then going to spend a bit of time orientating everybody to the anatomy of the shoulder joint. We're going to talk about common shoulder issues that arise after having a spinal cord injury, and in line with that, some specific challenges that also arise. We'll then move into how to keep the shoulders healthy, talking about how biomechanics can come into play, how exercise is important, and then we'll provide some advice about what to do if you do have shoulder pain, some examples of how physiotherapy might help, and some directions about some other resources that you might go to for help. Okay, so just to start off, why are we talking about shoulder health? And as Georgina mentioned, I suppose anybody who's here has an interest in the health of their shoulders. We know that to be able to have pain-free movement in the shoulders is an incredibly important part of, daily life. For the audience members today, I suppose you might be attending because you might have pain or you might have experienced pain in the past. Maybe you're concerned about developing pain, or maybe somewhere along the way you might have been told by somebody that you need to be careful of your shoulders. And so today, while we are quite specifically focusing on shoulders, it's probably also just worth noting that, yes, the shoulder is incredibly important, but other joints in the upper limb are also very important as well. And so the other joints of the arm also need to be, addressed at some stage along the way, but not today. Alrighty, and so if we think about who shoulder pain is an issue for, the short answer is that shoulder pain is an issue for a lot of people. So people who do have a history of spinal cord injury and people who don't have a history of spinal cord injury. Shoulder pain is quite prevalent in the general population, more prevalent in the population of people who do have spinal cord injuries. So we know that if somebody does have a spinal cord injury, some people might have complete or full strength in their upper limbs. Other people might not have full strength in their upper limbs. We know that maybe some muscles might have innervation, whereas other muscles might not have innervation. Some people might have small amounts of movement, whereas other people might have large amounts of movement. In the population of people who do have spinal cord injuries, we also know that a lot of people do rely on their shoulders quite heavily for their day-to-day tasks. So this can include, you know, all types of transfers, all types of mobility, and all types of reaching and manipulating things within the environment. Okay, so I'll start off just by giving a summary of the joints that are involved in the shoulder. So the shoulder joint actually involves 4 different joints, which are each listed here. So I'll read each of them out, but don't worry too much about remembering these words. So at the top there, we can see the scapulothoracic. Below that, we can see the acromioclavicular. Below that is the glenohumeral. And then over to the side, which is just at the front of the chest here at the sternum. So that is the sternoclavicular joint. And so in order to move the arm, movement actually occurs at all 4 of these joints. And through this unique design, the shoulder can achieve a really, really incredibly large range of motion. Through this design, it allows the shoulder to have quite a large range of functions as well. So the shoulders, they can push, they can pull, they can throw, they can carry things, they can place objects in the environment, they can retrieve objects from the environment, they can weight bear, and they are in charge of putting our hands where we want them. Here's just another image of the bones and the joints involved in the shoulder. This is just a shoulder at rest. So if you've just got your arms by your side and you're not moving anything. So something to have a look at here is if you see the bone that's labeled humerus, at the top of that bone is a blue kind of circle. It looks like a blue ball. So that is what we could call the ball in the ball and socket of the shoulder joint. And so this joint here is designed, like I mentioned, to allow for quite a large range of mobility. And because of that, it is an inherently unstable joint. So if you look at the ball section of the joint there, you might compare that in a kind of simple analogy to like a golf ball sitting on a tee. So the ball is a bit bigger than kind of the socket part of it. And so because of that, it does highlight how important it is that the muscles that surround the shoulder are all working at their best capacity with each other to stabilize the shoulder throughout movements. These images give some examples of what happens at the other joints when we're moving the arm. On the left is an image where the arm has been raised up about halfway, and we can see that the shoulder blade is starting to angle upwards. And then if we look over at the image on the right, if you can see that, you might need to move some faces on your screen. But over on the right, the arm is being raised all the way up to its end range. And we can see that the shoulder blade has angled further upwards And at the front of the body, the collarbone has also angled upwards to support that motion. So we've had a quick look at how the joints of the shoulder move during movement. Just some of the key muscles that are involved in moving the shoulder blade. A lot of the audience today has probably heard these muscles before. So just to show you where they are and what they do, over on the left, you can see where it's labelled trapezius. So this is a big muscle that helps to support the upward rotation in the shoulder blade. On the right, that one is called serratus anterior. That one also works together with the trapezius to support that upwards rotation to help to lift the arm up. Here is another big and important muscle that impacts on the position of the shoulder blade. So again, a lot of people would have heard about the pec muscles. There's a major and a minor, so a big and a small. The pecs can be quite a significant muscle in terms of limiting movement at the shoulder blade. And so if movement at the shoulder blade is limited, then that can carry on to affect movements at the shoulder joint. So moving forwards to another group of muscles. So I think a lot of people have heard of the rotator cuff. And this might just be a refresher for some people, which is good, or it might be new information for others. So the rotator cuff, it is a group of muscles that's positioned around the shoulder blade and the shoulder joint. On the left in that image, this is showing the shoulder blade from the back view. And we can see that there's this group of muscles that kind of sit and cover the whole shoulder blade and then attach right at the top of that ball and socket joint. Over on the right, this image just gives a bit of an idea about, you know, how many muscles are involved in shoulder movement and how they kind of all need to work in synchrony in order to produce a smooth and coordinated movement. So over on the right, we can see that there are some muscles that directly connect the shoulder blade to the neck. And there are also muscles that directly connect the shoulder blade to the torso. And so all of those muscles are also going to have an impact on how the shoulder and the shoulder blade are moving. These are some more diagrams of the rotator cuff. On the left, this is actually a view from the front of a shoulder blade. So this is as though the chest and the lungs have just been taken out and we're looking at it from the front. So once again, you can see that there's these rotator cuff muscles that attach directly onto the shoulder blade and then onto that kind of ball section of the ball and socket joint. And we can also see that down here where it says long head of biceps, we can see that that one actually attaches right up the top as well. And so that muscle or tendon is also involved in the rotator cuff complex. The diagram on the right, again, just a different view to give some orientation about this group of muscles. We can see in the diagram on the right that some of these muscles actually pass directly underneath the collarbone itself. And that's quite important because that can play into the biomechanics of movement somewhat. Okay. So this diagram here, don't worry about reading any of that. just have a look at the shape that we're looking at. So this is the shoulder joint cut in half. And what we can see is that it's pretty much a circle. And so surrounding the circle are the different rotator cuff muscles. And in this formation as a circle, it means that the rotator cuff muscles, they all work together as a group in order to produce what we call dynamic stability in the shoulder. So no rotator cuff muscle works in isolation. What they do is they work in synchrony to produce stabilizing forces all together. All right, so I hope that gave some orientation to what's actually inside our shoulder. So now we can start to think about some common shoulder issues that do crop up in clinical practice. So in terms of shoulder pain within the population of people who have spinal cord injuries, the most common cause of shoulder pain is overuse or injuries of the rotator cuff. Because of the nature of the rotator cuff, these muscles are susceptible to fatigue. And so repetitive fatigue or chronic fatigue can then lead to overload of the muscles and tendons, which can lead to pain or injuries. Another thing about the rotator cuff muscles is that because of the location of those muscles, they can also be susceptible to being compressed, which can also be a cause of rotator cuff related pain. Instability is also fairly common. So instability refers to when the shoulder joint, so that ball part of the ball and socket, when that part slides excessively during movement. And it's a very, very common thing to happen. What can happen as a result of instability is that then the rotator cuff become overloaded, and then this can again result in that rotator cuff related pain or injury. Arthritis can also occur at the shoulder. So arthritis refers to gradual wearing down of the joint surface. Other kind of causes or potential issues happening with shoulder pain can be related to decreased, can be related to muscle imbalances, changes in strength, changes in shoulder range, maybe other issues that are going on elsewhere in the arm might actually be contributing to pain at the shoulder. A very common presentation is actually that things that are happening in the neck will refer to the shoulder. And I guess an example of a possible but actually quite a rare condition that can also happen is frozen shoulder, which refers to a really quite significant restriction in the range of shoulder motion. Okay, so when we are considering these types of shoulder issues in populations of people who do have spinal cord injuries, there are some more specific challenges that we do need to consider. So one of the challenges that we can think about is that for some people, not all of the muscles that work on the shoulder joint will be innervated. And because we know that muscles need to work in synchrony to produce smooth and coordinated movement, if some muscles are not innervated or not working, then that's going to affect how the joint is moved. a lot of the time, compensations can be used so that the joint can still be moved, but if this is, a repetitive action or undergoing high amounts of load, then this might result in something like fatigue in muscles, which may then result in shoulder pain. Another consideration is whether other muscles in the torso or the legs are innervated or working. And the reason that that is important is that the shoulder, it doesn't move in isolation to the rest of the body. So if the shoulder is being moved, then the role of the torso and the legs are to either generate power or to stabilize the body for balance. So a nice example that Janet actually mentioned to me is that if we think about a professional tennis player serving, they're not standing still and just lifting their arm up and hitting the tennis ball. They're utilizing every other part of their body in order to generate that power. And then once they've hit the tennis ball, once again, they're utilizing every other part of their body to stabilize themselves and to prepare for the next action. And so if muscles in the torso or the legs are not innervated, then we can assume that the forces going through the shoulder when the shoulder is being moved are going to be higher, and therefore, once again, potentially making the muscles in that area more susceptible to fatigue and overload. If we next think about the implications of the weight-bearing shoulder. So earlier we had a look at the anatomy of the shoulder, and we saw that it's designed for mobility. So it's designed to be able to move in a really, really big range quite easily. And the shoulder is not designed to be a weight-bearing joint. And so if we think about what happens if weight is being put through the shoulder fairly often for transfers or standing or using a walking aid, and then the shoulder is also being used in other activities that involve reaching or, manipulating things in the environment, then that's placing quite a challenge on the soft tissues, because they're needing to kind of swap between the role of being strong and stable to allow weight bearing, and then move into more of that kind of fine motor and coordination role as well. And lastly, if we think about the demands of arm use versus the risks of overuse. So we do know that with repetitive upper limb movements, what can happen is that some muscles can develop more strength, while other muscles might become a bit more weak. So this can result in biomechanical changes during the movement, which then again might predispose certain muscle groups to fatigue and injury. So some common movements that might be contributing to rotator cuff fatigue might be things like wheelchair propulsion, transfers, whether that's seated lift transfers or using the arms and the shoulders to weight bear on mobility aids, taking the weight of the body during pressure relief strategies, or just any type of movement or activity that does involve repetitive overhead reaching. And lastly, if we also just consider the implications of having reduced balance on how the shoulder functions. So having reduced balance, either in a sitting or a standing position, it often results in the muscles around the shoulder joint to brace and turn on as a compensatory strategy. And so if certain muscles are kind of bracing quite frequently or quite consistently, it means that once again, the motion or the biomechanics of the shoulder joint might be affected as a result of that. Therefore, once again, potentially predisposing certain muscle groups to that chronic fatigue, which may lead to injuries and the process of pain developing. All right, so I'm actually going to stop sharing my screen now, and I'm going to hand over to Janet, who will start up the PowerPoint and continue on with the presentation.
Excellent. Okay, we've got my screen now. Yep. Okay. Thank you, Kate, for that lovely introduction about how the shoulder works and some of the things that we're commonly looking at in the shoulders after a spinal cord injury. My turn now to talk a little bit about how do we keep your shoulders healthy then in the face of some of these challenges. So really hoping to give you some ideas there about what you can do to maintain your shoulder health. So one of the classics, I guess, and you will hear this about most things in life, that obviously the better your general health and having a weight in the healthy weight range will certainly help you towards your goal of maintaining your shoulder health. Exercise is a really important part of maintaining shoulder health. Ideally, we would like to keep really good range and flexibility in your shoulder, because that allows you to be able to get your arms everywhere you are trying to do so, and maximising the strength that you have to be there. One of the things that we do want to consider, which Kate's spoken a little bit about there, is from some of the demands that you experience in terms of having to use your arms for either all or some of your moving about in the environment, means that you tend to use some muscles a lot more than you do others, just by virtue of how you're having to use them. So for example, for people who are either significantly using walking aids, or propelling a manual wheelchair and transferring, mainly using their arms, they tend to use their pectoral muscles a lot, and end up using some of the muscles that down rotate your shoulder blades, which is quite the opposite of what we're wanting for when you're taking your arms up and reaching. So what can happen there is you end up being stronger and potentially tight in some of those muscles. So we need to make sure that we're exercising and keeping the range, and trying to strengthen up and balance out how much our muscles are doing by helping strengthening the muscles at the back. The other benefit of exercise, and going to what Kate was saying as well, but obviously if you are keeping and maintaining some strength in your shoulder muscles, that decreases the chance of them becoming fatigued and leading to some of those other issues. Good fitness is another example of this. Obviously, the better your endurance and cardiovascular fitness is, the less likely you are to become fatigued during your everyday, the daily things that you need to be able to do and move around, and that decreases your chance of injuring your shoulder. One of the things we have to think about, particularly in light of I guess the challenge of potentially overusing the arms and having a large amount of load on your arms, is trying to manage how much you are loading up your shoulders. So for example, it might be, how many transfers am I doing? Is there different ways that I can be doing this so that I'm not putting as much strain and that on my shoulder? Is there any trunk strength or anything like that that I can exercise and strengthen to be able to help take some of the strain and the load off of my shoulders? One certainly interesting little tidbit is that our tendons, our muscle tendons, and particularly in the shoulder, they don't like change. They like doing the same thing day in and day out, and they like it all very much the same. What they don't like is when you do big changes, particularly. So if you, for example, go from having not done so much of an activity for a while to actually doing quite a bit of it, then they're not going to cope so well with that amount of change, and they might become sore and cause some problems. So certainly an example of this might be from our recent memory is we've all probably struggled a little bit in the last 2 years in regard to the amount of activity and getting out and about that we've done. And we, many of us have, certainly not had the options to be doing exercise and getting out and about. So sometimes it's not necessarily doing new things that cause some of the only challenges, but sometimes it's going back to doing something that you haven't done recently, but you haven't been doing it a while. Because in the life of a tendon, if you haven't done it in the last 4 weeks, it's as like you've never done it, because they don't, the strength and the specificity doesn't stay there. So how can we help manage that load to decrease the chance of injuring our shoulders when we're making these changes in different activities and that? Well, if you've not done something for a while, then it's about thinking, instead of going back straight to what you previously were doing, then you may be needing to gradually start back doing that and giving yourself some rest and recovery time in between. The same with new and different and exciting new activities. If you haven't ever done some of the movements, or you haven't done them recently, you're probably going to need to grade how much you're doing of that straight away. And that can be quite challenging when, you might be going to a new session that's going to, of a sport or an activity, maybe some dancing, that goes for an hour and you haven't done any of that activity recently. It's probably not the wisest to go in and do a whole hour of it. You're probably needing to do a little bit, have a rest, and gradually do a little bit more each week, so that you're not shocking the system, so to speak, on how much load change that you have done there. One really important thing to do in terms of trying to keep your shoulders nice and healthy is, if you do happen to get shoulder pain, that you actually stop and do something about it. So don't just keep on pushing on through it. You need to manage it. You need to be able to seek help to find out how to best treat it and try to resolve it, so that it's not just gradually getting worse and that you haven't made any changes towards trying to help that out. So I've just been speaking a little bit about the benefits of exercise and how we need to keep fit and try to strengthen up, and we've got that at one end, and then we've got down the other end the risk of us overusing our shoulders, and particularly when often for many of you, not all of you, but many of you, that your arms are your main source of movement and mobility. So what do we do about that? In terms of how do we find a happy balance in between, in terms of doing enough exercise and fitness and activity to help maintain and decrease the chance of ourselves injuring, but not overdoing it at the same time. So that's what I'm talking about, the Goldilocks amount here. What is the Goldilocks amount? I don't know. And unfortunately, there's no research or evidence that tells us exactly what that amount is, but it will be probably quite a different amount and different for different individuals as well. Okay. So another thing that we can do to help, I guess, decrease the strain and improve our shoulder health is having a think about the manner in which we move and the biomechanics or the essentially the physics behind how we're moving and the efficiency of that, and whether or not the movements are how our body is designed to move. One really important thing is if you are a wheelchair user, that your wheelchair is set up and it has features to decrease as much as possible the strain on your upper body. Now, some examples of that, and look, sometimes this is not always possible because there's always trade-offs between achieving good biomechanics and posture versus being able to do things. So sometimes we're often doing a bit of a balancing act. Certainly when you're sitting in a wheelchair, we would hope that you're able to balance without having to hold yourself up with your arms. Because as soon as you're having to hold yourself up with your arms, you've added another level of strain. So there are some changes and things that can be made. And certainly if you have been having shoulder pain problems, then it'd probably be wise to have your seating reviewed. Wheelchair pushing techniques, and in the same breath, the use of a gait aid as well. There's certainly methods that are more shoulder friendly than others. It's certainly been shown from a manual wheelchair propelling technique that when you, I don't know whether you can see me, when you let go, when you're pushing forward and let go of the rims, that your arms should come below the push rims before you grab them again, and that you certainly should let go of your push rims when you're pushing, so that you're able to use some of the natural roll of your wheelchair. What we're not looking for is your hand keeping on coming back over the top of your rim. So that certainly has been shown to be better for your shoulders in the long run. Transfers are another area that can certainly be looked at to see whether there's any better ways that are a little bit more shoulder friendly to be moving, and sometimes those things need to be re-looked at and examined if you've run into some problems with shoulder pain and indeed upper limb pain, as Kate was mentioning before. Posture can make quite a difference to how you use your arms. So for example, probably one of the major ones is if you are sitting, and some of you have to from a function, from an ability to balance and function point of view, that if you have to sit with your spine with a bit of curve in the top, and some of us are just stiff there anyway, but if my spine is here, then it makes a big difference to how far I can get my arms up, okay? So if you're not able to come out of here, then you are probably going to run into troubles trying to reach right to the top of your range, okay? And potentially you don't want to be doing repetitive movements right at the top of your range there. If there is something that can be done in terms of either strength or helping your seating to be able to get a better posture, then that may have some benefits for your shoulders. But I must say sometimes that is something that we can't change, but we do try to where we can. One of the challenges, as Kate mentioned before, is for quite a few of you, you are going from using your arms in a weight-bearing situation to, okay, now I need them to come to move around and reach for things and do overhead activities. And sometimes we can get a bit stuck down in this position, and it makes it harder for us to then go up. And so sometimes that's looking at how we're moving and whether or not things can be set up better for us in that regard. Another one that can help decrease some load for you in terms of your shoulders is another classic physics principle, in that if I've got a straight arm out in front of me and I'm doing something particularly repetitively with my arm out straight, that's quite a bit of strain and effort for my shoulder to be doing with what's called a really long lever. Okay, so if I can do the activity differently, or I can be set up the environment or with some equipment so that I can do the same task with my arms bent or a short lever, then that's going to certainly decrease the strain on my shoulders. And that comes into my next point about, I guess, setup, and I guess the other term that gets used is ergonomics of your workstations, hobby stations, or in the kitchen. If you're seated in a wheelchair, a standard bench tends to put your, repetitive activities that you're doing ending up being sort of at shoulder height or above. Our shoulders are probably their strongest at sort of 90 degrees and below. Once they come up a little bit higher, we are probably, they're not as strong, and they're probably a little bit more at risk from some of the timing and the good coordination may be missing in some of those activities overhead. So generally, we try to minimize the amount of overhead activities that we are doing in a repeated manner. So sometimes we are needing to have a look at how we're set up so that, can we do it differently? Can we modify the environment? Can we modify how we're doing it so that there's less strain on our shoulders? So I sort of mentioned a little bit there before in terms of trying to avoid potentially movements over the head, and particularly repetitive ones overhead. Unless if you've done a fair bit of training and you've done some strengthening and preparation exercises to be able to up there, that is certainly a different situation. But there are some movements that, in terms of how our shoulders are designed, that aren't as shoulder friendly, for example. So when we normally take our arm up above our head, we do it naturally, but our arms turn out to allow us to avoid some of that bony structure that's in the shoulder overhead as we come up. So if you're coming up above 90 degrees and you're doing a lot of turning in, you're probably more likely to aggravate some of those structures there. So they're certainly, again, a position to potentially avoid doing lots of repetitive movements in that position. Generally, that's not that common, although it can be slightly more common if you haven't got full movement in your hands and you're having to use some of the adaptive devices. Generally, when we're moving our hands, we tend to, and if we've got full hand function, we are tending to have our hands in that position, and we're already sort of turned out through our shoulder joint. So the next thing is really about exercise. So we've spoken a little bit about the help that exercise can be. So the first couple of things I probably want to say about exercise is, what is your goal of exercise? And I think that's a really important thing to be figuring out before you're entering into any type of exercise. So your goal might be having enough strength to do an activity. It might be to maintain the muscle balance around your shoulder and your shoulder health. It might be to keep fit, it might be your goal, or it might be to prepare for and to have enough strength and control to do some sports or certain activities. So a lot of what you're going to do exercise-wise is going to depend on your goal there. What I know probably many of you would love us to give you some exercises to do. Unfortunately, it's not that simple, because as you've heard already, the shoulder is quite a complex joint, and everybody moves and does things differently. You've all got different muscles working or not working, muscles that are tight or not. So it's not really possible for us to give you exercises to do over a forum like that. What is really important though is to get an individual assessment, so that you can get feedback on what's going on for you and if there's any movement patterns or technique that is needing correcting. In terms of who's best to help with you in terms of embarking on exercise for your shoulders and your upper limb, certainly we would recommend that you see a physiotherapist to help you out with that, particularly if you've got shoulder pain. Once you've seen a physio, it then may become also, you know, suitable for you to be seeing an exercise physiologist as well, to be helping out with your exercise program and monitoring of that. But generally, it's really good for both of them to be working together in that space. I will give you a couple of guidelines, I guess, in terms of things to think about when you're undertaking exercise and if you've been given a certain exercise or not. One of the things to think about to start with is, I guess, do I have enough range to be doing this exercise? Am I doing this exercise right at the end of my available range, where I may not have as much strength and control? So that's just something needing to think about. The other big thing with the shoulders, as you saw from Kate's slides, your rotator cuff is all attached to your shoulder blade, and then onto the ball and socket joint. Okay, so those muscles have got two moving ends. Okay, so if one end is not stable while the other one's moving, it makes it a lot harder for all of that to efficiently work. So it is quite important that your shoulder blade stability is looked at, and also that you get feedback about what's happening with your shoulder blade when you are doing exercises and movements, okay? Because sometimes you can certainly put lots of weights and things on, but the way in which you're moving and what's having your shoulder blades means that it's not necessarily going to work out the way you hoped, and may end up causing some pain issues. Balance is a really important other consideration. Do I have the balance to be able to be doing this exercise in this manner? As Kate mentioned before, if you don't have all your trunk muscles working for you, you can be subconsciously using some of your upper limb muscles to help stabilize, which can lead to different ways of moving and may run into some problems. So what can we do about that? Well, if you're exercising in a power wheelchair and you're having a little bit of trouble with balance, you can use the tilt function to help you out with that. If you are in a manual wheelchair, you may need to either only exercise with one arm at a time so that you can stabilize your trunk. You may not have enough balance to be able to do the exercise on both sides at the same time. You can also use a chest strap to help give you some artificial stability as well, so that you get not having to use those muscles to stabilize yourself so much while you're doing the other exercise. If you're somebody who's on their feet but their balance isn't great in terms of standing, it might be that you need to sit on a stool or a chair to do the arm exercises instead of trying to do them in standing. The other thing that I have spoken about before, but it's also about balance of what muscle groups I'm using. It's very, very easy in a gym when there's five exercise machines that do your pectorals and only one that does anything go backwards, to end up with not a great balance of the types and amounts of exercises you're doing. So as I spoke about before, particularly if you're already overusing the muscles at the front, then we just need to think about, have we got a good balance of exercises that are happening? Okay. What to do if you have shoulder pain? Okay. First of all, probably important to recognise what type of pain is it. And by this I mean knowing the difference between, oh, I've done some exercise and I'm feeling a bit, I know I've worked hard and I'm a bit sore, versus I've actually got a, I've got shoulder pain that is there on certain movements and continuing on. There are different types of onset of shoulder pain. Your shoulder pain might unfortunately happen in a specific incident or a fall, or it may happen as without an incident, which might be relatively sudden, or it also might be a gradual onset. If your pain has started from a specific incident or fall, then we would recommend that you do get screened for injury, obviously, and medical advice as to whether or not you do need any imaging in that case. In other instances, it's probably appropriate to go see a physio to have your shoulder pain assessed and looked at. One of the most common things, as Kate has already mentioned, is the most common cause of shoulder pain after spinal cord injury tends to be rotator cuff related pain. It tends to get grouped together in terms of being called rotator cuff related pain because, as Kate was talking about before, all those tendons and all the structures around the shoulder, the tendons all blend in, and they've all got nerve innervation and all the fluid sacs and everything in there, they've all got sensation. It's quite hard to know exactly what that's coming from, but the way in which we manage it, it is quite similar. The biggest thing is obviously if you do have shoulder pain is to decrease the load on your shoulders and your upper limbs at the time, because we need, and this is challenging, and I'm going to speak about it a little bit more in a moment, but this is really, really important because we need it to be able to settle down and recover, okay? And that's really hard when you're dependent on your upper limbs for many, many things. So how can physiotherapy help? First of all, we can do a very detailed assessment, not only of the issues within your shoulder, in your shoulder pain, but also what things might be contributing to that. So potentially looking at your transfers, looking at your equipment, looking at your environment and other aspects to see what is contributing towards this, and we can also diagnose what the problem that is occurring. We also can give you advice on suitable exercises, what movement patterns and techniques that might need to be altered, how to manage your load, and I'll talk about this a little bit more in a moment. When we're needing help from other health professionals, and that might be an occupational therapist, it might be an exercise physiologist, it might be your GP in that regard. We can also help you out in terms of what equipment might be useful to help decrease your load and also improve technique and your movement patterns. Once your pain has settled down, we can also help you out with increasing the load again and trying to get back to the activity or sport that you might be wanting to do. Also can help you out with retraining of those movement patterns and different transfer techniques and that as well. Okay, one thing that is, I guess, helpful and positive to know that certainly there have been research studies done in terms of the effectiveness of exercise and education and environmental modification on people with spinal cord injury pain, shoulder pain, and certainly it has been shown to decrease the incidence of shoulder pain. Okay, the magical load that I've been talking about. what is it? Okay, so load is a couple of different things. It's the amount of an activity that you're doing. It's the amount of times and the amount of effort and that you are asking of your shoulders and your upper limbs. And it's also a mechanical amount of weight and load that is going through it. So how do we manage it? If we've got shoulder pain, what do I do? How do I stop using my arms for periods of time to help my shoulders rest and recover? There are a lot of different options here. Some of it might be in terms of transfers. Can we decrease the number of transfers? Can they be done in a different way? Can we use some equipment to help out with the transfers, even if it's only for a temporary point of view? It doesn't necessarily need to be forever, but we do need to temporarily at least decrease the amount of transfers or the demands of the transfer. So that might be using a slide board, it might be using a hoist, it might be, if it's a particularly large gap transfer, it might be, or a large height difference, it might be doing it in smaller amounts so that you're not doing the whole amount at once. We certainly know that the bigger the height gap on a transfer, or the bigger the distance on a transfer, that more strain there is on the upper limb. And some of that is to do, as soon as your arms are further apart, some of the muscles aren't at as good a mechanical advantage to be able to help you. And so you are relying on your rotator cuff far more than you are when your arms are in closer. We can also try to change the environment in terms of how you're set up, how you're doing things, whether there's alternative ways of doing it. So all these small bits can add up in terms of being able to decrease the amount of load that is on your shoulders and your body. The other aspect there as well is that you might need a little bit of assistance for a period of time to help you not strain and load your shoulders as much while that recovery process is happening. Okay. Couple of things that I'd just like to mention, because I'm sure they're going to come up. The first one I want to mention is about imaging. The shoulder is no different than quite a lot of other areas of our body in regard to imaging. Imaging is certainly getting more and more advanced, and in many instances, like, so if you were to ultrasound probably anybody's shoulder over 20 to 30 years old, you can have tears in your shoulder, rotator cuff in your shoulder, and actually not have any pain. So imaging will certainly tell you where there is a structural defect. What it won't tell you is whether or not that is what is causing your problem at the moment. So it is really important to see imaging as one part of a piece of information, but it needs to be married up with the overall, does it fit what's going on for you as well. Corticosteroid injections can be quite effective, but they also need to be used sparingly. You certainly need to consult, I think, in regard to whether it's appropriate. And I certainly would encourage you to be assessed by a physio before you consider a corticosteroid injection. If you have repeated corticosteroid injections, there is an increased risk of tear and rupture of your rotator cuff. So they are an effective tool, but they need to be used very carefully and sparingly in the management of shoulder pain. Shoulder surgery is something that often comes up. and it's, you know, also a thing in the general population. Shoulder surgery is quite significant if you are a manual wheelchair user, certainly a full-time manual wheelchair user who is transferring. There's significant restrictions following shoulder surgery, where you're not allowed to weight bear or use your arm for 12 months. And not 12 months, 12 weeks, sorry. that's a bit extreme. Yeah, which is a significant consideration. Probably useful to know that in the general population, it certainly has been shown that conservative treatment and exercise is as effective as shoulder surgery at both 1 and 5 years in the general population in rotator cuff tear management. If you are considering shoulder surgery, I would definitely encourage you to speak to a physiotherapist, and it needs to be a fair bit of planning there, and also consider whether actually the complete rest that comes with shoulder surgery could be tried to see whether or not the pain can settle down. So, you know, giving it some good amount of rest, you know, actual rest that would happen as if you would having shoulder surgery as well. Okay, resources for help. I'll talk about the first couple and then I'll hand over to Kate to talk about some of the others. So I'm part of the Victorian Spinal Cord Service, and we certainly have a couple of parts of our service that can help you out with shoulder pain. Unfortunately, the service is for clients of the Victorian Spinal Cord Service. So that means you originally came through Austin and that in the, or had your initial rehab through the Austin Health. So the Victorian Spinal Cord Service, my apologies. So the Spinal Outreach Service, some of you may have used this already or may know about it already. So the Spinal Outreach Service is a team of some physios, some OTs, a nursing, and we have intermittently had some social work hours there as well. So they're particularly experienced clinicians in spinal cord injury, and certainly can help with assessment from a home environment point of view, looking at equipment to help decrease your load. And within all of this, you don't need to be using that equipment all the time. It's useful to be able to grade things up and grade things down. So they're a very, very useful service for helping out in terms of managing shoulder pain. There's my service, which is the spinal outpatient physiotherapy. So again, I can see anybody who is a Victorian Spinal Cord Service patient for shoulder pain. I also can, and so can the outreach service act as to help out other local services as well, in terms of some of the more spinal specific parts of managing that as well. And I'll hand over to Kate.
Okay, so the next stop point, local physiotherapist. You could definitely seek some help from a neurological physiotherapist, someone who has experience with spinal injury or the challenges involved in wheelchair use. Could be particularly helpful in terms of problem solving around those daily activities that may need to be modified in the presence of shoulder pain. Otherwise, musculoskeletal or a sports physio could also definitely be helpful to help to manage your shoulder pain. People who work in this field will have specialised knowledge about, you know, the musculoskeletal aspect of the joint and management. Just keeping in mind that the area where these types of physios probably won't have as much knowledge or maybe no experience in is kind of the transfers and the equipment side of things. So definitely, you know, community physios who work in neurological fields and musculoskeletal fields can work together, so they could communicate together to really optimize a treatment plan if you do have physios involved from different fields. That is definitely something that some people do choose to do with good success. Otherwise, in the community, OTs, so occupational therapists, can definitely help with, say, the equipment prescription side of things, and again, kind of planning around daily activities or environmental changes that might be considered. And again, in the community, exercise physiologists can be invaluable in the advice and guidance they can provide in terms of exercise programs, which can be, you know, tailored to what you want to be achieving in general, while also incorporating management of your shoulder, and probably realistically that would be in collaboration with a physio as well. Your GP is always a great kind of you know, base for your health management in general. So I would suggest that if you are experiencing shoulder pain or shoulder issues, do keep your GP informed of what's happening, and they might have some guidance or some assistance in terms of the medical side of things that they might be able to help with. And otherwise, a really good source of information could just be peer support. So if you have any contact or connections with, you know, other people who have spinal injuries, or maybe other people who use wheelchairs or mobility aids, then I think that a lot of practical and really helpful advice can be shared on that platform as well. You got anything else to add to that, Janet? You're on mute, Janet.
Myself, sorry. Yeah, and look, I think in some cases there definitely needs to be a team approach in terms of addressing some of the issues, and to ensure that, you know, you're less likely to get shoulder pain again if you have had that experience. I'll stop sharing.
Thank you, Janet. Thank you, Kate, so much. It was a wonderful presentation, very informative. Lots to take in, particularly all about the anatomy of the shoulder. I know we're not expected to know all about all the bits and pieces, let alone try and pronounce them. But yes, it's amazing, our bodies and how many things are working together just to make one single tiny movement. And so important to know that we need to take care of our bodies and not overuse them. I know it's a bit silly for me to say, being a wheelchair user myself, but yeah, being mindful about the things that can go wrong if you're you know, not taking care. There were a couple of questions or comments that have popped up. The first one was about injections. Well, Christine's made a comment that she's had injections in her shoulders and it's helped with the pain, and she's reduced the load by introducing measures like using her power chair instead of her manual chair. And not sure if it was a question or a comment about whether her shoulders will recover. You may, Janet or Kate, you may want to comment on whether the injections, how long do they last, or what's the benefits of doing injections, and yeah, if you could make some comment about it.
You want to do that, Kate, or you want me to?
If you're happy to start, and then I'll add if there's anything extra.
The injections, so a corticosteroid steroid injection it's like, I guess, a supersized anti-inflammatory. So it's got to be a condition that where there is significant inflammation, and not just inflammation on an ultrasound. Inflammation does tend to, it has a certain characteristic in terms of how it presents. Certainly night pain is one of those aspects. And in terms of, if you've got a very mechanical pain, so we tend to categorize pains in terms of whether they're a mechanical or whether they're an inflammatory, and it's a kind of a continuum between those. So a mechanical pain is very much, I do the movement, I get pain, I stop doing the movement, I stop getting pain. Whereas an inflammatory pain is more of a constant pain that is not really changed by a particular movement as such, and a lot of them are probably somewhere in between on that continuum. So you would only really be considering an injection down the inflammatory end of that spectrum. The other aspect of that is for an injection to work well, you've actually got to change the situation about why it happened in the first place. So if you're going to have an injection and go back to doing exactly the same things with exactly the same biomechanics, and you haven't changed a thing, then the chance of the injection, of you not having ongoing pain post the, sort of the effect of the injection is going to be very limited. So I think avoid thinking about them as a way to quickly fix it, and not make any other changes as to why that's happened in the first place. Does that help? I hope.
Yes, I'm not sure if Kate wants to add or if Janet said everything.
So the length of time that they last for, I would say a couple of months, give or take a bit either end. They do need to be used sparingly. They do weaken the tendon. So if you've had an injection and you're continuing to place high loads through your shoulder, then your tendon will be vulnerable to damage or injury during that time. Which is why if cortisone injection is part of a rehab plan, which was why we would be monitoring your load and your activities, and gradually reintroducing load to the shoulder.
Okay, thank you, Kate. There was a question whether the Victorian Spinal Cord Service outreach team would visit regional centres again soon.
So the outreach team doesn't physically, well, some of the members of the outreach team do the regional reviews, which those of you who attend those would be familiar with. So some of the team do go out and do those reviews. In the COVID world, those reviews have been happening by telehealth currently. The outreach service in some instances can provide remote support and remote and I guess consultative help to local regional therapists in terms of advice and that. So that is something that's probably changed a little bit since we've all got very good at telehealth in the last couple of years.
Yep, absolutely. Thank you. There is a good question for people who have higher level injuries. For someone that has a C5 or a C6 brachial plexus injury, what sort of possible surgeries would be available?
Okay,
tendon transfers?
Yeah, again, that has to be, there is an upper limb, the upper limb team here based at Talbot, and that would require, they have to assess you quite thoroughly to be able to tell you what they can and can't offer offer you. And often there needs to be investigations done to be able to pinpoint, you know, what can and can't happen, because all of those surgeries have to have either donor nerves or donor muscles that need to have a certain certain strength to be able to be useful in the surgeries. I'm trying to think. I can probably find the email for being able to inquire about those aspects. I'm pretty sure there's a generic email for that, so I can find that out for you.
Thank you, Janet. Thank you. I just have a question myself. I have recently done some, not necessarily shoulder injury or rotator cuff injury, but I've had a couple of times strained my neck and my traps, lifting my wheelchair out from the passenger side and over to get it out of the car. And that was pretty much basically because the wheelchair got stuck and I strained myself. Now, also because I'm getting older as well, I'm seriously considering changing that and getting a hoist or some other piece of equipment rather than me doing the transfers manually. I'm just thinking whether things, or there's a different train of thought these days for physios or even OTs to suggest to people to go down the hoist path or that sort of method of putting your wheelchair in your car, as opposed to manually doing it right from the beginning, just to save your shoulders. Or it all depends, I guess, on the person, what they want to do with their own vehicles. But yeah, I'm just thinking I'm thinking maybe I could have preserved my shoulders maybe a year or two had I started that way right from the beginning.
Hindsight's a wonderful thing, isn't it? Do you have any comment, Kate? Or?
So I work in my role in the community. I don't necessarily work with that many people that are at the very start of their journey with spinal cord injury. But I think, Georgina, it's a really great reflection that, you know, thinking back about the vehicle and whether that would have influenced your shoulder pain now, I think really could be, you know, just a really probably helpful discussion point in peer support type of settings like this. I think when I do kind of have conversations about vehicles with clients in my role here, everyone already has a vehicle and most people have been using the same vehicle for quite a long time. And so transitioning to something different, yes, it would probably be very, very helpful for a lot of people. But again, it's so individualized that it really depends on so many factors, you know, in different people's lives and circumstances.
Yes, absolutely. Thank you, Kate. Thank you, Janet. Now,
sorry, I can probably add a little bit. I think we've probably changed. There's definitely been a change in that in response to whether it's promoted from a earlier stage. I think if you think back of what equipment people went home with and what we suggested, you know, 30, 40 years ago, and there will be those of you in the room who had their rehab through that period, it is totally different to what we teach now, even down to the fact that we don't recommend people to lift to pressure relieve anymore. It's more about leaning and both from a shoulder preservation point of view, but also effectiveness of pressure care. So things are definitely changing. It also it's very similar to the classic do you do transfers onto the toilet or do you use a commode debate as well. Yes, we probably encourage people towards commodes earlier than we ever used to, but at the same time, it's also very much it's a choice thing, and sometimes it's just a thing that we encourage as you age as well. So
yeah, I'd just like to add also with transfers, any type of transfers, I've noticed that life is just getting a lot busier and people are doing things a lot faster, not taking note or concentrating on what they're doing. And that's where a lot of the injuries may occur. And that's what I've noticed with me in particular. I've rushed myself and not thought about what I was doing, and I've had a few injuries that way. So that's something to keep in mind, is that to slow down, concentrate, and do it the correct way with the right technique you've been taught. And yeah, just again, as a preventative measure. So if there's more questions. I'll go back a step so I'm not missing out on anyone. Regarding a healthy weight range, is being underweight a concern? This is a C4 incomplete with central cord syndrome.
Probably not from a shoulder. The healthy weight range is probably more about load on shoulder. Healthy weight range is obviously ideal, because there's there's issues with being at the top end of the healthy weight range as much as there is at the bottom end. It's probably more pressure and other issues that happen at the bottom end of the range. It probably depends on whether or not some of the underweight is from lack of strength and muscle bulk where able, but it really depends. That you can only do something about that if you've actually got nerve innervation to those muscles. So yeah, I hope that helps answer the question. Do you want to add anything, Kate?
No, I agree with everything there.
There was one there, Georgina, about I haven't quite read it properly, about from Latrobe Valley. Regional supports.
Did I miss one? Must have.
Yeah, just about regional supports.
It would be valuable for regional services to be promoted and available, as there is such a thin market in regional areas regarding SCI supports and information.
So I'm just not quite sure whether I've got that question the right way around. Certainly, when we were talking about local physios and that, we are sort of including certainly the public services amongst that, and local community rehab services and regional services in that. So I'm not quite sure whether that's what you were talking about, or the fact about the support out to the regional services in terms of consultative support. Are you able to, clarify?
Yeah, I'm not too sure. If the person who asked the question wanted to clarify, or if your question's been answered, then that's good. We've got Brian suggesting from an OT point of view, we should also suggest to explore funding from the NDIS, if that's available, to look at vehicle modifications for a hoist, or any sort of equipment that could help your shoulders as well, I guess.
Yeah, and not just NDIS. One of the things that, it's funding sources for all aspects of that. Certainly, if you're in the SWEP system, that's actually one of the better funded items on the SWEP in terms of vehicle modifications, and that's still not awesome, don't get me wrong, but it's certainly looking at what you need, and then trying to be able to find assistance towards and support towards the funding from multiple sources.
Now, I've just seen the time. Kate, I understand you've got to go, so please feel free to go. But I'd like to just say thank you so much for joining us today and for your presentation with Janet. So it's fine. We could continue on with questions if Janet doesn't mind answering. But yeah, so you can leave whenever you like.
Georgina, this
Yes.
is Sam Chrissy here.
Hi, Sam.
How's it going? Listen, I just got a question. I've done everything incorrectly, the same as you, all my life. And I've just been recently had scans, and I've got a complete tear on my rotator cuff. Does that inevitably mean surgery? Do you know anybody venture to comment?
I would probably want to read the report or the thing, whether it actually is because there's the difference between a full thickness tear and
That's what they say it is.
If it's a full thickness tear, it's not a rupture. Okay, I might just quickly explain. Well, I'll endeavour to explain this. A full thickness tear is like a buttonhole in your tendon. Okay, so it's not that the tendon's been ruptured off the end. Look, you can do that. Don't get me wrong.
Yeah.
But if it's a full thickness, what it means is it's going from the top surface through to the bottom like a buttonhole.
Okay. Yeah.
It's totally different to a little thin. It all depends on where it is in your tendon. Is that the design of the shoulder is phenomenal, it really is, and it's got all these features in there to help out with some of this, and it really depends on where it is relatively along the tendon.
So there is a possibility that it might not have to be surgery.
Yes.
Is that what I'm hearing?
Yes. Yeah. You need to be assessed.
Yeah. No, I'm going to see a specialist. I was just listening to the program. I just thought it'd be interesting to ask you. Yeah. Because that surgery scares the shit out of me, to tell you the truth.
Well, it's a big undertaking. It's a really big undertaking. And I think you want to definitely have considered all your options and have, been assessed by all the relevant health professionals, not just medical.
Yeah, fair enough. Okay. Thank you very much.
So surgery is usually the last resort, isn't it?
Yeah, well, I don't really want to have it, Georgina, but when they told me it was a full thickness, they were saying, well, it looks like that's about the only option you have, but I don't really, and I thought I don't understand how physiotherapy would help that, but maybe it does.
It can. It depends. Yeah, it needs to be fully assessed, Sam. So, look, there is a possibility that it may not, but it also is significantly.
So Janet should be assessed by a physio such as yourself, as well as a specialist who's probably a surgeon. So he's probably going to want to do something.
Well, yeah, you do always have to remember. I'm obviously remember what is in each person's toolbox.
Yeah, that's right.
In terms of that, and you have to accept that bias from that. But certainly full thickness tears can be managed conservatively.
Oh, okay. Well, that's very encouraging. Thank you very much for that.
I would also recommend if you to speak to your consultant about it as well, not just the surgeon.
So when you say consultant,
presume you have
not just a doctor.
Do you still have reviews with a spinal specialist?
Haven't had a review for COVID's cut that out for a while, hasn't it?
Oh well, physical reviews. Yes.
Haven't had one for 3 years. I think it's been 3 years.
Yeah. So Pat, I think perhaps get in contact with some of the resources we've sent out and get yourself assessed. I think it's probably.
Are you guys completely open again? Are you? At the Austin?
We're still telling for the annual reviews, unfortunately. But the rest of it's sort of generally open. We're working around things as best we can.
Ah, fair enough. Okay. Thank you, Janet.
My pleasure.
Good question, Sam. There was just a comment from with your experience, past experience with people with surgeries, how successful have they been?
Kate, have you had anybody?
Sorry, I was actually just going to jump in and say that I'm going to log off. Thank you for coming, everyone. My contact details are at the end of the PowerPoint if anyone wanted to.
Probably put that back up again. Let me.
Thank you. Yep, that's good. Thank you. Everyone want to take a photo snap of that? But I will be sending those contact details to everyone. So it's really handy. Thank you. Does anybody else have any other questions that they would like to ask the group? And if you could put yourselves off mute, that's fine as well. Saves you typing. But overall, it was quite a comprehensive presentation and covered lots and lots of areas that we need to be mindful of. One of the takeaways for me was the actual, like all the muscles that are involved. And I do have an exercise physiologist, and one of the important things is that you have all these little muscles that you aren't even aware of in your back that we need to I guess, wake them up a bit and help support our shoulders and all our other body parts. But yes, it's that posture, that shoulders back sort of thinking that you always have to concentrate on your posture to help, I guess, with your overall shoulder health. Colin, do you have a question?
It was more of a statement. Through snow skiing, I've torn both shoulders at different times because you tend to catch an outrigger and your arm goes behind and then you land straight on the shoulder. Just for for Sam, who was asking about recovery, they were only minor tears, but they recovered them on their own. My wife has had a bad tear on hers with repeated cortisone shots, and hers has repaired itself without surgery. But a friend had one where she'd torn totally through, which required surgery, and she's had a good result on that. But that's just some observations that there are. And the surgery was her only option.
Okay.
Thank you, Colin.
Thanks, Colin. I do know of somebody that's had surgery as well, and it's been successful too. But yes, it is something that you need to think hard about, because it is quite a long time that you're out of action, and having the right supports for you to help you with your day-to-day activities. And yeah.
Yeah, it's scary, Georgina.
Of course it is, of course. But yeah, let's see what other options you have first and explore those. I think that's a good idea.
Okay. Thank you. Thanks a lot.
Okay.
Any more questions?
I might head off.
You've got to go, Janet. Yes, I understand. Thank you so much. I appreciate your time as well. So I guess this closes the presentation. Thanks everyone for your good questions and for showing up today. Hopefully you got a lot out of it.